life needs to be put on track.
And we've been able to do that. Second is the kind of patients that benefit from this expertise being available.
Hospitals to come over and give us more details on the season.
Be here. I think it's a very important milestone for. We must all appreciate the fact that lung transplants are the most challenging transplants. Share that with you. The other aspect is that, and one of the reasons, the fact that it's so complicated, is because one, the niche talent, the deep expertise that's required to pull it off is not available in many hospitals across the country, is available in very few hospitals across the country, and Apollo Hospital Bangalore is probably one of the few centers in the country to have that expertise, so we are very privileged to have that. And the fact that it's a cross-functional effort that is required between pulmonology,
Tuesday night, midnight, if your WhatsApp goes on when Ligimo's team is telling us there's an organ available, your tendency.
So the question is why a lung transplant is a complex procedure and what challenges doctors and patients are facing. The patients, of course, are facing a massive influence on their quality of life before the transplantation. They're deteriorating progressively, and depending on the actual disease will progress rapidly or slowly, but ultimately all will come to advanced lung failure, which requires then oxygen support, increasing oxygen support, increasing immobility, increasing inability totally to do activities of daily living, and of course then they'll be bedbound and they will succumb unless lung transplantation is offered to those that it is appropriate for. So patients come and have a specific workup to make sure they are a candidate for a lung transplantation, and if so, they are registered with the Jivasarthikade, and when a suitable organ is found, then we do the transplant. You heard earlier how it is difficult, unlike liver and kidneys, to match lungs and hearts, but lungs more so because it's the size of the cage, the cavity inside your chest for the lungs, which will vary based on whether you're male, female, your height, and the disease process itself. So we have to do this very carefully because we want to avoid having to cut lung from the donor, because the outcomes are not as good and the post-operative course can become more complicated. Now, patients who are referred late have a poorer outcome. They're much riskier procedures for them because they will have lost so much weight and muscle, they cannot breathe normally, even with the lungs. The new lungs are just like balloons. They will not blow up and down without us actually using the muscles. Without these muscles, the lungs will do nothing. So we have to train these patients. Sometimes they need a tracheostomy in the neck to take them off the ventilator, and it can take a long time. So for the doctors, doing all of this is very complicated, not least in terms of safeguarding the organ from rejection or infection, which is much riskier for the lungs compared to other organs. And in India, we have a greater burden of fungal infection, which can complicate the lung transplant severely, where they will be in ICU for much longer, which means more complications, more cost, and more hospital stay, and a very prolonged rehabilitation afterwards. So to get a smooth course, we want timely referral, good surgery, and discharge home within 3 weeks, back towards a normal life. This is obviously a complex case because she was so late in her disease process. And she had a very narrow window within which to have the transplant procedure to enable her to recover and return to now a normal quality of life. There are other patients we transplant that are much more complex in terms of the technical aspects and even in respect of ICU care. Many patients who deteriorate so much so that the oxygen is not enough, that they have to be put on ECMO. This is external pipes in your veins and sometimes arteries to have an artificial lung support. That is ECMO, for extracorporeal membrane oxygenation, used heavily during the COVID time across many hospitals in India. Those patients are more complex. And some diseases where the lung is completely stuck to the chest wall can be even more complicated. So there are more complex issues, but for this lady, it was really the timing, without which she would probably not. Managing the medical aspects and recognizing when they should be referred to a transplant center, advanced lung failure center. That is the most important challenging thing, which actually is not happening well. We are being referred patients so late that their course is going to be prolonged, the surgery becomes more complicated. Then the challenge is one of matching the donor with the recipient, as we mentioned. So you can even have an in-house donor. You can have many donors, even with the same blood group, but you may not be able to utilize the lungs for that specific patient because the size is inappropriate. Or the other thing we have not mentioned so far is there's some issues of immunological issues where the patient has what are called antibodies that may react with the donor tissue. So we do all this testing, and if we find there's a conflict, then also that stops us from using those donor organs. Then, of course, there are the technical, anesthetic, and intensive care issues of challenge during and after surgery. And then comes the most important part, which is long-term surveillance of these patients when they're back in the community, which is rigorous discipline of outpatient follow-up, timely biopsy of the lung in the initial phases, and then a lot of blood tests that check on the status of the immunosuppression, which has to be taken for life, but also to assess if issues about the donor antigens are still there to cause damage to your own tissues. And your tissues are fighting because the organs are a foreign body to the recipient. So in order to prevent you rejecting that as a foreign organ, you have to be on immunosuppression. You must have your defenses lowered so that you can accept somebody else's organs as your own.